when do you know when you need a biopsy?
So we had kind of touched on that earlier. If you have a mammogram or ultrasound that's given a BI-RADS 4 or BI-RADS 5 category, that would mandate a biopsy. In addition, there are other instances where maybe the imaging does look normal, but the patient has a palpable mass that they're anxious about, and sometimes in that case we will also order a biopsy, or a palpable mass where you can't see anything on imaging, but you can actually feel the mass, and that always mandates a biopsy as well.
Now, a biopsy, is that the only way to see how the breast has changed?
So a tissue diagnosis is the only way to know for sure that a lesion is benign. And I'll let Kate go into this a little bit more of how the biopsy is actually performed. But the most common way to diagnose a breast cancer nowadays is what's called a core biopsy, where we actually take a small piece of tissue out of that lesion and have the pathologist look at it under the microscope to give us a diagnosis.
Now, just because a doctor orders that biopsy doesn't necessarily mean you have cancer, right? Or
So absolutely not. Like I said, the vast majority of patients who have biopsies do not end up having breast cancer.
Okay.
But that doesn't change the fact that they may have what we call indeterminate findings, findings that require a tissue diagnosis to know 100% for sure.
Now, what are you removing when you do a biopsy?
So when I do a core biopsy, I'm doing one that's image guided. So that means I'm either using mammogram, ultrasound, or MRI to guide me to the area.
And at Miami Cancer Institute, you mentioned you only do tomosynthesis mammograms, correct?
So yes, we only do tomosynthesis mammograms. It's part of the standard package. I think, in fact, the patient would have to ask to not have tomosynthesis to do it. Oh, and also, so we also use the tomosynthesis imaging to guide us to the area. And what will happen is when a patient will come in for a biopsy, using whatever one of those imaging modalities we see the area best in question, we will then numb up the breast tissue and we get a few very quick needle biopsy samples of the area, teeny tiny little bits of tissue. We're not removing the area in whole.
Right.
We're just getting enough to get a tissue diagnosis.